Welcome. I'm Dr. Stacy Meyers, and I'm going to present my research on the lived experiences of women diagnosed with stage 2 or greater gynecological cancer. Gynecological cancer is defined as cancer of the female genitalia or reproductive system. In 2021, it's estimated approximately 900,000 women will be newly diagnosed with cancer, and approximately 168,000 of these cases will be gynecological cancer. Approximately 42,300 deaths will be associated with gynecological cancer in 2021. Women with advanced stage gynecological cancer, specifically ovarian, uterine cervix or cervical, and uterine corpus or endometrial cancers, have poor prognoses. Women diagnosed with late stage gynecological cancer encounter unique physical and psychosocial stressors. These stressors include cancer related stigma, late stage diagnosis, distinct experiences of isolation and loneliness, intense decisions related to treatment, and extensive treatment regimens which may result in the loss of reproductive capabilities. The existing body of literature identifies individual stressors or symptoms, quantifies symptom experiences, or focuses on one type of gynecological cancer and/or treatment process. In previous studies, there was an exclusion of a holistic perspective of the gynecological cancer patient experience, including the acknowledgement of shared experiences across gynecological cancer types. The purpose of this study was to explore the lived experiences of women diagnosed with stage 2 or greater gynecological cancer, including personal perceptions of quality of life, cancer-related stigma, and the health-illness transition. This study was guided by 4 research questions, including what are the lived experiences of women diagnosed with stage 2 or greater gynecological cancer? What are the health illness transitions that occur in women diagnosed with stage 2 or greater gynecological cancer? What are the perceptions of women of the stigma associated with the diagnosis of gynecological cancer? And what daily behaviors of women are influenced by the environmental stressor of the cancer diagnosis? Melissa's transitions theory and Roy's adaptation model informed conceptualization of this study. An interpretive phenomenological approach was utilized to guide the research study. Purposive and snowball sampling techniques were used to collect qualitative data via in-depth, semi-structured individual interviews. 10 women diagnosed with stage 2 or greater gynecological cancer were interviewed, and an outpatient oncology clinic associated with a large regional hospital in the Midwestern United States was the setting for this qualitative research study. One semi-structured 60 to 90-minute interview served as the means of data generation. Informed consent and demographic data were collected prior to the start of the interview. The semi-structured interview was comprised of 13 open-ended questions with probing statements. An interpretive phenomenological approach, Benner's method for analyzing qualitative data, and Saldana's processes of manual coding were used to guide data analysis. Approval for this study by the Mercer University Institutional Review Board was obtained. Secondary approval was granted by the hospital IRB. Sample demographics are included for your review. There were 5 themes and 12 subthemes that were a result of this study. The first theme was the existential experience of time, and the subthemes included from then to now, the physical and emotional experience, health illness shift, and perceptions of the future. The second theme was awareness of loss, which included the subtheme of the concept of self, moments with family and friends. The third subtheme was navigating new waters. This included the subthemes of feelings of relief, the stigma of cancer, and maintaining the status quo. The fourth theme was sustaining faith, which included the subthemes of belief in a higher power and purpose in the experience. The final theme was moving forward, which included the subtheme of resiliency and the new normal. This research promotes understanding of the personal perception and impact of an advanced stage gynecological cancer diagnosis, including adaptation to the environmental stressor of cancer, discovering meaning in the cancer experience, and its effect on survivorship. The unique physical and psychosocial symptoms women experience are intertwined and influence patients' perceptions of time and quality of life. Communication by the healthcare provider was highlighted as a vital component to the patient's cancer journey and established the critical impact the nurse's relationship with the patient can have on this process. Implications for practice include improving knowledge of the physical and emotional changes these women experience, in addition to recognizing the losses women encounter and the modes of adaptation utilized throughout the cancer journey. Thank you.